Dr. Max here. Well, I wanted to share a actual patient's stool test results using the BiomeFx. I'm really excited about this because this is a really awesome microbiome stool test that we'll get into all the results and why this one is really great in a minute. But it's being combined with Jona AI. Basically, this AI is designed to help synthesize all the latest research evidence, the thousands of articles and studies and papers that come out every month, and synthesize that so you can have the cutting edge, latest recommendations for what to do about your own digestive health issues. And you can come back to the same test 6 months later, and based on the latest research evidence, perhaps the recommendations will have changed. So this was accurate and cutting edge about a month ago when I got this patient's results. But I thought this was a great example of a stool test and how the BiomeFX can be useful for you if you're looking into different ways of doing this. So the AI platform looks a lot different than this. This is the paper PDF version that I've printed out and removed personally identifying information to protect the patient, the client. But all this information is the same there, and you can download this PDF for your own case, in addition to using the online portal where there'd be a lot of patient information that I can't share. So this PDF is pretty comprehensive. Disclaimer about the results, the information here. And just for my own protection, the information presented in this video is intended for educational, informational purposes only. The microbiome stool test results discussed are from a real patient case. However, all identifying information has been removed or modified to protect patient privacy. This video is not intended to diagnose, treat, cure, or prevent any disease and should not be considered medical advice. The interpretation of lab findings, including microbiome testing such as BiomeFx, should always be considered within the context of a person's complete health history, symptoms, physical examination, other relevant clinical findings. These are all my personal opinions and based on my experience and review of the latest scientific literature. Individual tests may vary, and findings discussed in the case may not apply to any particular person. Always consult with a qualified healthcare professional before making any changes to your diet, lifestyle habits, or healthcare plan. BiomeFx is a proprietary microbiome testing platform. Any discussion of testing results or potential clinical applications reflects educational interpretation and should not be construed as an endorsement, guarantee of outcomes, or a substitute for individualized medical care. Now, the disclaimer's out of the way, let's get into the results. I'll give you a table of contents, and we'll just go through everything here. So they give you an overall summary. First off, are there any pathogens? Of course, if we have any infections, any parasites, we want to know about those because those can be a major hindrance to addressing chronic digestive issues, inflammation, and pain. So we had one potential pathogen, a type of bacteria, and then one potential parasite. But overall, this person had a really excellent gut score. They score it out of 40 points. So you can see here, 34.69. That's pretty darn good. And they break it down into four major categories. Resistome occurrence. So this is the genetic material in your microbiota, all those microbes that may be resistant to antibiotics or antimicrobials. Pathogen control, how well your microbiome is crowding out pathogens, fighting them off, keeping them in check. Alpha diversity is the diversity of your particular sample. And the beta diversity is comparing your particular sample to a relatively healthy population and what we would like to see overall. And getting into the functional analysis, proteolytic fermentation is a fancy way of saying breaking down proteins, and saccharolytic is breaking down fibers from things like carbs. They have a couple major categories: methane production, because that's often a problem with people with IBS, constipation, SIBO. This person did not have any of that, which was great. Vitamin biosynthesis, 2 out of range. So this isn't a measure of your actual vitamin status. So they're not testing like folate or B12. They're testing your microbiota's ability to produce those things, because certain vitamins can be made by the microbes in our gut, which is pretty cool. So we don't have to be solely responsible for some of those ourselves. And then it breaks down into how the microbiota are affecting hormone production, breakdown, recycling, as well as neurotransmitters, because some of them are very important for overall health and well-being, and some are largely produced in the digestive tract, like serotonin, one of our feel-good neurotransmitters. And they break it down even further into health categories, and they'll analyze if there's any research evidence related to brain health, gut health, metabolic health, skin health, physical performance, and compare that to your sample. And then they give you top actions like one, fight off infections that we can see here. Two, increase the anti-inflammatory foods, and they'll give you an example list of foods they'd recommend, and increasing vitamin D. And there are some foods that you can get some vitamin D from, like egg yolks and seafood. So overall, as I said, this person had a really good gut microbiome index. Out of 40 points, that's pretty darn good. And so you might wonder, why did this person even do this test? Well, this person had a long history of SIBO that was predominantly methane. So a lot of constipation, poor circulation, cold, hypothyroid that had been going on for a long, long time. Had a history of a lot of stabbing, trapped gas pain, and very irregular bowel movements. This person had largely been improved for a long time, but at their job became significantly more stressful over the last couple of years. This lady said that her stress was a 10 out of 10, and she was starting to get more constipated. So she wanted to get on top of this before SIBO or dysbiosis or hypothyroid ended up becoming a bigger issue than they already were. This person was regularly making their own 24-hour homemade yogurt. So this woman was getting huge doses of probiotics every day in the yogurt, along with some fiber. I think it was like oatmeal yogurt bowls with some blueberries and things like that. And she said that between the homemade yogurt and a magnesium supplement, very common for constipation, just to support regularity, those two ensured that she was having a bowel movement most days, which was a huge change for her compared to when she was a teenager, and she'd only go every couple days and never really felt like she completely void. So again, really great score here. Her alpha diversity, she had over 200 species in her microbiota, really good. The average American has 100 or less, compared to people that still live a hunter-gatherer lifestyle, say out in the savannas of Africa or in South America. They'll have more to like 400 to 600 different species in the gut microbiome. So the goal for most Westerners, we're trying to get more than 200, because a lot of people aren't there, especially if they're eating an inflammatory Western style diet. So this person's actually pretty good. 214 species, the diversity is 8.4 out of 10. That's really good. The beta diversity is comparing that sample to a healthy cohort. So like what would be a healthy population? What would we expect to see there? And also really good. So 8.1. When we get down here to the resistome occurrence, again, the abundance of different antibiotic resistant genes that are present in the gut microbiome, and they compare that to a healthy population, and this person was really good. So there weren't a lot of genes in there making their microbiota resistant to, say, if they need antibiotics or an antimicrobial regimen. No, this person would be able to withstand treatment and likely kill off any pathogens if they happen to be present or if we needed to do something like that. And you can see the pathogen control index. Um, this represents low levels of pathogens because she has a pretty high score. And that is typical of a healthy, diverse gut microbiome. If there had been more pathogens, then this score would probably be lower. But right now, it seems like with all the diversity and the relative low level of potential pathogens for this person, she's doing quite well. They then go into dysbiosis ratios. So dysbiosis, a common term for an imbalance in the microbiome. So an easy way to do that is look at the phyla of different types of microbes. Phyla are large families of microbes that are kind of grouped under different categories. And the balance between those phyla and their ratios can give you a better idea of what type of dysbiosis or imbalance a person might be dealing with. So the Firmicutes to Bacteroidetes ratio, they changed the name of these just recently. Another reason to keep up on the latest digestive research, because these things can change depending on what we're learning about them and more advanced DNA or genome analysis. This changes as we get older. Um, and is associated with a wide range of things, metabolic issues, digestive complaints, cardiovascular disease. And so keeping this in a better ratio has better health outcomes as we get older, and especially regarding chronic illness. Another classic one, the proteobacteria to actinobacteria ratio. This one's really important for a lot of people that have dealt with SIBO or IBS because the proteobacteria are known to be opportunists and to take over. And if they're overgrowing in the stomach, the small bowel, or the large bowel, that can lead to major dysbiosis. And they're associated with a lot of inflammation because the proteobacteria produce the LPS, which is an endotoxin present on them, but the immune system responds to that with a lot of inflammation, fever, joint pain, skin reactions, brain fog. If that gets through the lining of the barrier and is associated with metabolic endotoxemia, which is associated with leaky gut, intestinal permeability. Then we get into the keystone organisms. These are ones that we like to see in a healthy microbiome, and you can see that a lot of them are quite good. They're either average, maybe below average, and some that are even above average. But overall, these are pretty darn good. When these are not present or they're in really low numbers, then we start to wonder if there's some sort of inflammation, stress going on, a dysbiosis. Because if these are healthier, then they can help support the microbiome manage stress and be more resilient. So given the fact that this person is 10 out of 10 stress, starting to get more constipated, not exercising well, not sleeping well, this is going to help serve her a lot better because these commensal keystone species can help keep the microbiome more rock solid even during these times of stress, which is the whole name of the game, right? You can see even her Akkermansia, a really famous one for overall digestive health, supporting that healthy mucus lining in the intestine is also average here. So happy to see that. When we get into the functional analysis, different types of breakdown products, saccharolytic fermentation, this is how well the microbiome is breaking down fiber to turn into short chain fatty acids. These are prebiotics that help to feed the microbiome and the intestine and the mitochondria. Butyrate is the one that is probably the most famous, and her levels look right in the money, really good. Propionate is another good one. Um, is related to the metabolism of lactate, good for healthy immune function and preventing an overactive or underactive immune response. A little bit elevated, but overall quite good. Same thing with acetate here. Certain prebiotics will help provide the fuel for the microbiome to create these short chain fatty acids. Again, we need these because they help to support the gut barrier. They support proper immune function. They help to provide food and energy for the intestinal cells. So they support the mitochondria in your digestion and your gut anyway. And there's a lot of cool, compelling research coming out about things like butyrate to show that it can help calm down chronic cases of IBS, SIBO, those diseases of that gut-brain interface, when a lot of other uh, supplements or medications just aren't really cutting it, because this helps to support the healthy microbiota in the gut and make a better terrain and environment for all these other interventions, which is pretty cool. It feeds the mitochondria in your intestine. Lactate production, um, part of carb metabolism. So this can be another marker of how well those keystone species and microbes, Bifidobacterium, Lactobacillus, are behaving. Um, we get into proteolytic fermentation. This is a breakdown of protein, amino acids in the colon. They will produce some short chain fatty acids, but higher proteolytic fermentation is associated with more inflammation, more problems like too much ammonia, too much hydrogen gas, which can be related to SIBO, and other things that the body has trouble breaking down and needs to metabolize and get rid of in order to be healthy and not be so inflamed. So overall, doing quite well there. Uh, Polyamine production is right where we like to see it. P-cresol, a breakdown product of tyrosine. Tyrosine is an amino acid that's used to produce dopamine. And when again, when these are elevated, these can be very inflammatory and difficult for the body to detox. A great one here to speak about is ammonia. Ammonia is produced through normal metabolism every day as we're breaking down and using proteins. If your body produces more ammonia than it can detox at one time, that can be a major problem. It can lead to dark circles under the eyes, brain fog, fatigue, inflammation, gut irritation. So this is a really important one to make sure is getting metabolized and broken down and removed from the body through the kidneys and the urine. Hydrogen sulfide production. Um, this is a gas that can be related to SIBO or IBS. Excessive gas from hydrogen, say from eating too much animal protein, can lead to symptoms of IBS and SIBO that are typically associated with more quick bowel movements, but a lot of trapped gas can also be an irritation there. Methane production, as we said before, certain microbes in the gut will produce methane. Methane is associated not only with trapped gas and pain, but constipation, slowing down digestion, poor circulation, hypothyroid. So given this person's history of having that more methane dominant SIBO with constipation, this is really good that they weren't detected. So it seems like her previous SIBO treatment worked. And as long as she's helping to support her microbiome, keep things regular, it hasn't come back yet, which is really good to see. We get into certain hormones and neurotransmitters because some certain hormones are broken down or recycled in the gut, and certain neurotransmitters are largely formed in the gut, like a lot of serotonin, a lot of dopamine, um, other ones that are very important for normal digestive function, like GABA, which helps to kind of calm things down, or acetylcholine, which is connected to the vagus nerve and can be very anti-inflammatory, supportive of resolving those chronic digestive issues. So GABA production, an inhibitory neurotransmitter, it helps support stress, helps to regulate sleep, and this looks right on the money. So very happy to see that. Glutathione production. Glutathione, very famous. It's one of the most important antioxidants in the body. Very helpful for liver health, but a lot of cells throughout the body can use glutathione as an antioxidant to manage things like too much radiation or heavy metals or other free radicals that we get, say, in our diet if we're eating a lot of fried or grilled foods. Glutathione can help with that. It can also be really helpful for supporting liver health in people that may have fatty liver or are dealing with other liver problems there. And if you don't have enough of the precursor, certain amino acids, um, then the body won't be able to produce as much glutathione, which can increase your body's stress response. You won't be able to break down things as well. You may have more fatigue, poor recovery from exercise, more chemical sensitivity. Like some people will report getting headaches if they walk down the detergent aisle in the grocery store if they're not able to produce enough glutathione and break down that stuff. Here looks really good. Histamine, this is a hot topic when it comes to chronic digestive issues. Histamine is associated with mast cells and the eosinophils in our digestive tract and our immune system. They release all these pro-inflammatory compounds, typically in response to an allergen or a parasite, but certain types of microbes can become um, more important here and influence our enteric nervous system, the nervous system in the gut, related to our regularity, our inflammation, the migrating motor complex, keeping food moving, how well the body responds to infections or microbes or just normal foods in the gut. Histamine can be very pro-inflammatory. And so for a lot of people that will eat something and then later, say, get brain fog or major fatigue, joint pain, maybe their skin reacts to it, they get a rash after they eat certain foods, and maybe because they're producing too much histamine. And that's related to something that people are just starting to understand more about, mast cell activation syndrome, which is a syndrome that has symptoms all around the body, but is associated with those immune cells, mast cells, producing too many inflammatory things like histamine. So we can see here, this is a bit higher than we'd like. So um, certain aged foods, cheeses, dried meats, alcohol can increase the exposure of the microbes to these things that can release more histamine in those immune cells. And um, it, as I said, is related to chronic IBS, migraines, things like that. So this person may need to start watching out for eating too many like aged cheeses, staying away from wines, things like that. Another one I'd like to highlight here, estrogen recycling. For a lot of women that have irregular periods or maybe dealing with PCOS or are trying to improve their fertility, we want to see how well their body is recycling or removing estrogen. So Certain microbes in the gut will activate enzymes that can help to recycle estrogen as it gets through into the stool, or can keep it moving so it just goes out of the body. And if you have too much estrogen recycling, and the types of estrogens we're talking about here tend to be the more inflammatory kinds, that can be a major issue when it comes to having regular periods, managing hormones, blood sugar, inflammation, fatigue, because hormones are very powerful chemicals. We only need them in very small amounts, but they have a profound effect on our metabolism in our body. And this isn't just important for women, it's important for men too, because men produce some estrogen, testosterone, other steroids and hormones as well. And estrogen, if it's too high or too low, can really influence the other levels of things like how much testosterone a man is making. Now, when it comes to vitamin biosynthesis, again, we're talking about the microbiota's ability to synthesize and utilize what you're eating and what it's taking in to produce certain vitamins like vitamin K2, which is important for bone density and people who deal with osteoporosis, but also certain B vitamins like folates that we can get in things from our diet, like a lot of leafy greens, or vitamin B12 that's very important for inflammation and for nerve health. So we can see for this person, her microbiome is not really capable of producing any vitamin K2 at this time, at least not in the sample that was provided, but may be producing too much B12 and folate, B9. So that's very interesting. If this person is having high levels of folates or B12 in the diet, they might be actually making too much, which would be uncommon, but have had a couple clients and patients with excessive B12 levels leading to other sort of nerve issues. Then what's really awesome is, again, we're dealing with, the latest research in the microbiota and how our microbiome affects all these different, because we know there are so many. Um, let's see, I think I accidentally unplugged my microphone, so hopefully you can still hear me. Um, all the different ways that this research can be related to certain health concerns, like if you want to maintain attention, coordination, have a steady mood, manage stress without, you know, uh, crashing out, as they say, how your body can break down certain fibers or sugars like lactose. So good for this person. She's eating yogurt pretty much every day to maintain that regularity, and her body's good at breaking down lactose. So that's great, but maybe not as good at breaking down soluble fiber. So if this person is eating, say, a lot of beans, legumes, they may have more trouble breaking those down, and that may be part of the reason why she's having more trapped gas. In terms of health concerns, you do a questionnaire when you uh, submit your sample and talk about your complaints like abdominal discomfort, bloating, uh, health of the colon itself, gas, and it can show you based on your sample what is the association between the symptom that you're worried about and what your microbiome is telling you and the research evidence. So we can see, say, with colonic tissue health, it's somewhat relevant based on her sample results, and the research level is established between that connection. So we can say, like, yeah, with um, pretty good confidence that yes, the sample displays, X, Y, and Z, and this patient is worried about colonic tissue health. Well, we know there's a connection there. And that if there's any imbalances, dysbiosis, infections, that addressing those will help to support colonic tissue health, which is one of this patient's goals. They also give you an overall score. So like metabolic health, overall is really good. So even though this person is concerned about autoimmune thyroid sensitivity, given the history of hypothyroid, um, there's there's not very much to be concerned about here. Her skin health, excellent. Physical performance, excellent. Again, this was a really good sample. Most of the ones you're going to see will not be this good or have this high a score. Then they give you a personalized action plan based on your results. And again, this may change as time goes on, and you're seeing the latest research evidence, which I think is really cool. You can customize your goals or preferences, and the AI program will modify that for you as well. So you can see that current score is excellent for pretty much everything. that this person may be concerned about. And then they give you an idea, your calculated score based on if you follow through with the personalized recommendations. So for this patient, um, goals to reduce pathogens and parasites because there was one pathogen bacteria and one potential parasite pathogen in this stool sample. Recommended actions, things to do, increase vitamin D intake. Great, can help with stress, support resolution of leaky gut, and help to regulate glucose. Some examples of common foods you can get that in, really good. And the associations of increasing vitamin D and how that might affect all of the different microbes. So really cool. Like what's awesome about this and is often beyond the grasp of any particular clinician, including myself, is how can you stay up on all the latest research? You need something like an AI tool to help synthesize it for you. We have all of our book smarts and brain smarts. We just don't have the hours needed to digest literally all of that information. And here we can create a program that can customize it and stay up to date along with us as we're learning. Advice to increase magnesium, anti-inflammatory diet. Who doesn't need that? Especially if you're dealing with a lot of stress. Vitamin K, increase that. So I know that this patient started taking supplemental vitamin D3 and K2 drops to help, get both of those in one shot. And that can be a very simple supplemental support that a person can take in a few months. Just get some updated lab work to see if the vitamin D level is getting too high or if it's, nice and balanced where we'd like to be. So you can see how this is all very personalized and includes foods and why this would be beneficial for a person and what are the expected changes in the microbiome. Can see if this person follows through with all of the recommendations and personalizations their clinician or practitioner will give them, their current scores, and how it may be how the score may change as time goes on. With this person, it seems like, they're relatively healthy. So there's not a lot that there is going to be calculated like an associated change, but for most people, they're going to have a much more dysfunctional microbiome, and if they follow through on all of these things, they'll be feeling significantly better, and those scores will probably get much, much better. Top organisms to change. They give you recommendations for what are sort of the heaviest hitters you can see here, and how the abundance of those microbes will increase or decrease based on those changes. So we can see for a lot of these, it's going to increase the relative abundance of all these beneficial, helpful things. For this person, again, they're either average, even above average, maybe a little below average, but not too bad in terms of balance. Recommended food list based on their results. The overall balance of the different microbial phyla, those big families altogether. The pathogens, again, what they're associated with. So Bacteroidetes fragilis, higher than we like to see, can be related to gas, diarrhea, gluten sensitivity, blood sugar issues, autoimmune thyroid, or pain in the head. And a protozoan parasite, Entamoeba coli. No clear associations based on her goals and results, but could be a potential pathogen depending on what this person is dealing with. Then it goes through a bunch of pathogens that were not observed, bacterial types of E. coli, toxin producing ones, viral pathogens. Some people are dealing with chronic viral activation in the gut, fungal issues, parasites, different types of parasites. I mean, it's very thorough, which is very cool. Select commensal bacteria. These are some of the ones that we really like to see, like Akkermansia, which is considered a keystone species, very important in a healthy microbiome, and all of the different associations with that, the different health conditions that may be related to too much or too little Akkermansia, for example. Typically, it's going to be too little, but I have had a few cases where it's too much Akkermansia because everything's about balance, right? Dysbiotic overgrowth. So these are imbalances and overgrowths in the microbiome and what they might be associated with. Again, for most of these, not a major issue for this person, but you can see how it just gets very detailed, very specific, because we're checking out the whole genome and relating to that all of the latest research evidence. See, what else? Was there anything I even wanted to discuss? The bottom, they tell you how to read your analysis. Again, if you're on the online platform, this is going to look a bit different. I've changed this to block out the personally identifying information for this person, specific definitions. And so, yeah, there you have it. A very thorough, very personalized approach combining AI to synthesize all the latest research evidence so that the patient, the client, can determine what is going to be best for them with the highest payoff. And me, as a clinician, can give them much more personalized recommendations. And then, based on my own personal experience and what the results are here, what we might expect, how you can realistically add some of these changes to your own diet and lifestyle, because some of this stuff can take a while. Again, this was a really good sample. This person was doing really well overall, but 10 out of 10 stress, starting to experience some of those symptoms she had in the past. So she wanted to get ahead of that and make sure it didn't get bad again. Well, I hope you found this educational. My name is Dr. Max. I'm a chiropractor and functional nutrition practitioner at Maximal Wellness Clinic, and I work with people dealing with all sorts of chronic digestive issues like IBS, SIBO, IMO, acid reflux, functional dyspepsia, and I do that through health coaching programs to help people deal with these chronic issues, find the root causes, develop a personalized plan, and help them implement that in their diet and lifestyle in a sustainable way so they can eat more foods and they don't have to deal with chronic pain and they can improve their fatigue despite, years or even decades of having dealt with this stuff in the past. So if this is interesting to you, save this video, reach out to me, or we'll see if we can help you feel your best. All right, take care.